I'm really honored and grateful to the colleagues in PIMA that they have invited me for today's talk. So I will start with the first talk, and this is something which may not be for something specific about the drugs, but rather a holistic approach about the diabetes, that how we are looking at it and how we see the things in diabetes, that how we are doing it. So in Pakistan, we majority of looking at the things in a way that we are a nation of 245 million people. This is one of the 5th largest population in the world, and we have got 33 million people suffering from the diabetes, which is again the 3rd largest population and one of the highest prevalence of diabetes in the world. Then we have got 40% of the population below the poverty line. So if we look at the things, these things are actually giving us an alarm that the speed with which the diabetes is rising, that's something which is really alarming for this part of the world. What is the cause? The cause is one of the reasons that this pandemic of obesity is going. If you look at 1992, look at the TV and look at the guy, and in 2021 and 2024, look at the television and look at the guy. So this is something which really has transformed the prevalence of not only the obesity but many other diseases also. Reason? The reason is actually that we have really increased our portion size from a small packet of fries, a small drink, to the large 1 liter, 1.5 liters of drinks, and a large burgers, fries, and that all leads to the, again, one of the problems of obesity. Then another thing with which we are actually doing is actually we are eating a lot, but we have left actually the exercise and diet. So we left the exercise, we have increased our portion sizes, and then we are actually becoming more fatter and fatter, and these all things will lead to the prevalence of diabetes. Now, what happens that if you increases your weight, what happens? The most deranged thing when increasing your weight is actually the obesity. So once you are obese, that means you are increasing your chance of heart diseases more than a general population. As obesity increases, you can see from this chart, the prevalence or the ratio of heart diseases will increase. You just increase your 1 kilogram of body weight, and that increases the cardiovascular risk by 3.1% and your risk of diabetes by 4.5 to 9%. So just increasing 1 kilogram of weight will put you in the problems of the cardiovascular risk and the diabetes. The people with diabetes are 3 times more likely to die of the heart disease. The most common problem or the most common cause of the death in a diabetic patient is usually the cardiovascular disease, and the problem is another thing which actually gives the problem is actually the stroke. So people with diabetes are more likely to develop the heart disease. We all know. I'm working at the NICVD, and what I'm seeing, young patients 30 or below 30 years of age, they are coming with the MI, with the heart failures and with the other things. And again, this is something which is mainly related to the diabetes. And 80% of people with diabetes will die, as I said earlier, due to the heart attack or due to the stroke. This is again emphasizing, which may not be new to all of you, but just for my junior colleagues who are looking at or practicing at the primary care level, that you should know what is exactly the diagnosis of the diabetes, that we can tell our people. We don't say them कि जी अभी शुरू हुई अभी तो छोड़ दें, ऐसे नहीं है. अगर आप किसी को डाउट वाली बात करेंगे तो मरीज कभी भी जो है ना वो परहेज नहीं करेगा, मरीज उसको सीरियस नहीं लेगा. तो यू शुड बी वेरी क्लियर अबाउट द डायग्नोसिस ऑफ द डायबिटीज दैट A1C of 6.5 or higher is the diabetes. Fasting blood sugar level of 126 at least for the 2 times if there are no symptoms, or a random blood sugar of 200, for example. If no symptoms, then at least 2 readings. With symptoms, just 1 reading is more than enough to make the diagnosis of the diabetes. What is the pathophysiology? I still remember, my seniors are here, that we usually, when we were medical students, there was only one pathophysiology, that's actually the lack of the insulin. But now really the time has changed and there are many factors which are lead to the diabetes, on which again the insulin, impaired insulin secretion, impaired hepatic glucose, increased hepatic glucose production, impaired appetite, decreased glucose uptake, increased glucagon, decrease in incretin effect, and increased lipolysis and increased glucose reabsorption. Now, when we know about the pathophysiology, then what happens? That there are many new drugs are in the market that actually work on that pathophysiology, and that gives you actually the management of the diabetes. Initially, that we all know that there were only one sulfonylurea, metformin, and the insulin. But now you have got so many drugs to combat or control the diabetes due to that pathophysiology. Now, the main concern of all of us when we treat the diabetes is actually prevent the complications, because right from a primary care level or primary care physician up to the level of endocrinologist or specialist in diabetes, we all are concerned that we prevent the complications of the patient. If we see somebody at the age of 30, 35 years, then we try to prevent him from the diabetic retinopathy, which is again something which is main cause of actually the diabetic eye disease, diabetic nephropathy or future renal failure, stroke, cardiovascular disease, as I said earlier, and again diabetic neuropathy. So the main focus of management is not only looking or controlling the blood glucose level, but actually preventing the complications in these patients. Now, we are all, majority of us are Muslims, and we have got a faith that there is a day which is fixed when you will go from this world. So we cannot change that day or that time, but at least what we can do as a doctors, that if you look at the green level, this is the healthy lifespan. So if you treat somebody properly, you can increase that healthy lifespan and you can prevent him from the complications. You can prevent him from some, for example, the cardiovascular complications, the rheumatological complications. So actually what we are seeing, that the period of life free from major chronic disease and disability, so we can increase that, but we cannot increase the age of the patient. Now, if we look at the holistic approach, so it's not only the glucose control, but the main, again, second thing is actually the risk reduction in the management of the diabetes. Another thing is actually, which is nowadays is very important, is the weight management. And last but not the least is actually decreases the disease burden. We try in this part of the world that at least we can prevent the diabetes. We pick the people early at the stage of, for example, pre-diabetes, or before that, we prevent the diabetes. But if someone has got the diabetes, then at least we can reduce the risk reduction and reduce the complications in these patients. This is something which is normal glucose. If you look at it, when the glucose uptake is increased, that increases the glycogenolysis, normalizes the blood glucose levels. But again, if the blood glucose is increased, then definitely the other pathway will come into the action, and there is a balance, is a natural balance in the body that actually maintains the blood glucose in our levels. Now, why glucose control matters? What is the reason for glucose control? Now, this is again something on your left side is a famous UK PDS study that says that 1% reduction of HbA1c will prevent you from so many complications. But again, on your left side, if you look at this one, the reduced total diabetes related cost. If you have got a controlled diabetes, definitely your visits to your doctor will be decreased. Your investigations, the cost of investigation will be decreased, and that all will give you 20% decrease in the diabetes related treatment cost. So again, a good control will give you not only the free from complications, but rather a decrease in your pocket. This is something which is new, 2024. I don't want to go into the detail, it's a busy slide. But again, the first thing is actually is the diet and exercise. Then is again something which is metformin. But nowadays, what we are focusing on that right from the start, we should consider the atherosclerotic cardiovascular disease. We try to give them treatment that will prevent the atherosclerotic cardiovascular disease. Then heart failure, which is again something very common with the atherosclerotic cardiovascular disease. Number 2. Number 3, the kidney disease, which is again one of the main reasons for the dialysis in these patients. So we try to treat the patient in a way that we can prevent these complications in these patients. If we move further, then we start the treatment. But what happens that we will not intensify the treatment. So what's happening that when we start the treatment, then definitely after 3 months, this is always mandatory. You look at the patients, look at again the blood glucose levels and see whether your patient has really improved. Is he on a target which you set for the patient or he is not? So this is something which we call as actually inertia, in which we do not intensify the treatment. This is something which is actually the different factors which are related to the patient inertia. So if you look at it, in people with type 2 diabetes, HbA1c more than 7%, taking one OAD, the median time to intensification for a second OAD was 2.9 years. 3 साल लग गए जब हमने उनको सेकंड दवाई ऐड की, और 7 साल से ज्यादा लग गए जब हमने उनको पहला इंजेक्टेबल ऐड किया. So this is something which may be sometimes on our side and which may be sometime on patient side. So there are different factors. From patient's perspective, the insulin or the injectables, the patient feels is the last resort, and we should counsel them this is not the last resort. Then again, weight gain with the insulin, hypoglycemia, but again what I said, that now there are new drugs which may not cause the weight gain. For example, the GLP-1s, they do not cause hypoglycemia. So we have got different options now, rather multiple options for the treatment of the patients. From physician's point of view, we are very busy. We have got a busy clinics. We may not have got enough time or extra time to counsel the patient for something extra. Then these all factors will join together and give it rise that the patient's control may be delayed for some time. Again, the healthcare system, what we are looking at it, we do not have got the enough specialist people, enough hospitals which them treat properly, because we are a poor country and everybody cannot afford the private health, or the drugs are expensive. So that's something important where the role of the healthcare system comes into, and that's the responsibility of the government, that they should provide an adequate healthcare or the management to these patients. So what we need, we always need a multifactorial approach. Few things which you always keep in mind, that HbA1c, should we keep it less than 7%, we encourage them to have a physical activity more than 150 minutes per week. Blood pressure less than 140/90, TG less than 150, HDL more than 50 for women and more than 40 for men. And the another thing which I would like to add is the LDL cholesterol. If the LDL cholesterol hasn't got any atherosclerotic cardiovascular disease, then it should be less than 100. But someone who has got atherosclerotic cardiovascular disease with the diabetes, then the LDL should be less than 70. So what we manage in a holistic approach is the glycemic control, lifestyle modification, BP lowering and dyslipidemia. These all factors together constitute the proper management of the diabetes. Now, lifestyle intervention, few slides more. Exercise, nutrition, behavioral therapy, and follow-up. All these things together will lead to the long-standing good control of the diabetes. This is the food. We recommend that the fruit should be more, the vegetables should be more. This is the recommended diet for a diabetic person. But if you honestly look at our society, what we are eating this one. You go to any marriage, any party, majority of things we will eat all these things, but we always consider this is not fair, but these things should be encouraged, these things should be given to these patients, that they should have a healthy lifestyle. Then smoking, which is again injurious not only for the diabetes but actually for the cardiovascular disease also. So we quit smoking. Smoking to khatam ho gayi, shisha shuru ho gaya. So I think so, which is more injurious. But again, this is something which is state responsibility, that should take strict action against these shisha bars and all these things. But this is something which, being a doctor, we always discourage that these things should not be there. Then spend less time sedentary. या तो हम सारा दिन मोबाइल पे बैठे होते हैं, we look at it, or we are in front of the television, which is again increases your sedentary time, which is again leads to the obesity and uncontrolled blood sugar levels. So if we look at this is actually, we eat 5 servings of fruits and vegetables. Number 2, 2 hours or less of recreational screen time, 1 hour or more of physical activity, and 0 sugary drinks. This is again something which is very important, not for us, for our young generation, that these fizzy sugary drinks, they are really something which is bad for your health. So please avoid yourself and discourage your younger ones to avoid from these sugary drinks. So last, again, something which is important, prevention is better than the cure. So prevent the obesity. What you will do, you are actually preventing the diabetes, you are preventing the cardiovascular disease, you are preventing actually the rheumatological problems in these patients. So a 30 minutes of exercise a day can reduce your risk of developing diabetes by 40%. So just 30 minutes of physical activity, keeping your weight in a normal BMI, will reduce your chances of diabetes by 40%. So still, if you are young, I think so you can do that. This is 30 minutes is not a big deal per day, and that prevents you from these complications. So I conclude that the treatment always should be individualized, and every patient is a different patient. So there should be a patient-centric approach, and the cardiovascular safety should be on top. Whenever you prescribe a drug, we should know that it has got no cardiovascular side effect, rather it has got cardiovascular benefits, that the long term your patient will benefit from it, and we try to prescribe the drugs that will not cause the weight gain. So there should be no weight gain, and should be low risk of hypoglycemia in these patients. Thank you very much for your patient listening.